Hi guys, my name is Midi Ojo. I'm a general dentist and cosmetic dentist based in Twickenham and in Hampton in the Surrey area. At the British Dental Conference and Dentistry Show, I'm super excited to be talking about Curodont Repair, which is a product that's really paying wonders in my clinical practice, not just with my general patients, but also with my sporting clients. I do a lot of work with high performance sports players, and they take on a lot of sugary drinks and obviously a lot of high carbohydrate foods. And we're finding that the caries rate in these patients is particularly high. So with using modern technologies, we're now able to regenerate and actually protect and prevent further disease in these patients. The thing about elite athletes is oftentimes from a very young age, they've had to be taking on these high energy drinks or energy supplements, and that repeated intake is often causing effects on their dental health. Not only that, depending on the demographics of the patients themselves, we're finding huge disparity in the levels of dental caries. So unfortunately, some people just aren't educated. So the intake with poor dental education is actually causing a rampant disease, and in many patients, it's quite a prevalent thing. So what we're using now is Curodont to actually be one of our first markers to prevent and actually help these patients for the long term. With high performance athletes, as I said, sometimes they're not actually getting the education that they need, and access to a dentist for these sports stars isn't as commonplace as you would expect. So I'm very fortunate that I'm invited into some of these clubs to provide a screening on a biannual basis, and I can actually assess the patients in their own work environment. Then they come into my practice where I've got all my tools to be able to assess and diagnose much earlier and offer some solutions. So the beauty of using something like Curodont Repair is that traditionally we used to have to wait until the disease has actually taken part, and then you're working backwards. Now we have the ability to regenerate using the body's own ability to heal. It's a fantastic solution for our patients, and we're not having to wait. It's saving our patients from having a lifetime of repeated dental treatment because we can intervene and regenerate things at a much earlier stage. Technology is really helping us here because traditionally we had just x-rays and clinical diagnosis, but now with the advent of technology such as AI, we have dental x-ray technology that's now identifying caries before it's even an established lesion. Using things like that really allow us to intervene and treat before the disease has taken place. Also, with a lot of the dental intraoral scanners now, we have visual aids that can actually help us identify those potential areas. So the two things together in terms of diagnosing and also using things like very good illumination and actually magnification really give us everything we need to be able to treat and actually help these patients. As I said, traditionally you would wait until the disease was evident. Using the technologies now, once we can diagnose and identify, using Curodont Repair, we're able to regenerate what is actually the body's biologic state and reverse and actually strengthen so that we're not actually getting cavitation at all. When you come to see the talk, you'll realize how simple and how applicable this technology is. And when you place it on the patients, you really know that you're giving them a solution. And if I'm honest with you, when you tell a patient that you can reverse something before it becomes active, I think it's a no-brainer for almost all of our patients. The technology behind Curodont Repair is really quite clever. You're using the body's own minerals to regenerate. So what happens with Curodont is it has a very, very clever peptide which infiltrates into the early lesion. By doing that, it actually allows the body's saliva to attract ions, so calcium and phosphates, back into the tooth, and that actually allows a matrix to form where the tooth actually regenerates. And again, the studies show you both clinically but also radiographically, and again using things like illumination, a reversing of the actual initial lesion, and that in itself is saving patients a multitude of dental treatment. So for general dentists treating general patients, I would say that this technology is applicable for all. Yes, I must admit that in high performance sports players, we see it on a more frequent basis, but I think even with young people and the population in general, we're seeing people taking on a lot of highly carbonated drinks, fizzy drinks, and of course these repeated assaults on your teeth are going to cause problems. So I think yes, it's useful for sports players, but actually for the general population, I think you'll find that this is a solution for many of our patients. I like to think of myself as a wet-fingered general dentist, so I work 5 days in practice, so hopefully what you'll find is what works in my practice. And I've found that this solution with Curodont Repair has really made a huge difference, not just to me personally, but also to my dental therapy team, who are now able to offer solutions that weren't possible before. So what I hope you'll find is how this fits into your armamentarium and is an option for all of your patients and also for your wider dental team. I'm really excited just to be part of the show and to see all the advancements in technology. I'm hugely into AI and the advancements in that. So some of the things that I'm really excited about are the AI and the note taking, because for me, I'm such a busy clinician. I don't have that much time, but I'm finding that implementing the right AI partner is improving my workflows. So that's something I'm really excited about at the Dentistry show.